Dr. Hong, tell me about what kind of tumors were there in the clinical trial?
Yeah. So the initial 55 patients in the Larotrectinib data set that we shared, probably if you looked at all the different subsets and kind of categories, the largest category was really sarcomas, GIST, undifferentiated sarcoma, et cetera. And then the other subcategory or categories was probably mask tumors, which are these tumors that arise from the head and neck, oftentimes mistaken for salivary gland or parotid tumors.
So they're not salivary gland tumors. They're different than that.
I think they're a subset of salivary gland tumors, and they're but oftentimes mistaken for just standard salivary gland tumors. And so if you have an expert pathologist look at them, oftentimes there can be clear differences. And then some of the pediatric tumors were included in the initial 55 data set. And then when we updated the most recent data set at ESMO of 122 patients, in those 60 some patients that were entered, there was additional subsets of tumor types like thyroid cancers that we identified. So as I shared, I think we don't fully know the full prevalence across all different histologies. However, we do think that they do exist in most histologies. And I think we will find out as now that this drug, Victroxi, is approved, and as people are looking for these patients in their NGS panels or their regular practice, that that number may be further defined as more and more patients are enrolled on these trials or get this drug.
So what you're saying is then this, so for salivary gland tumors, a subset is very highly expressed. So most of them you would kind of, if they came to your practice, you would test them with at least NGS, and we'll talk. It's a bigger, more broader discussion later. But those ones seem to have a high percentage, especially in this subset of salivary gland tumors.
Correct, and I think what's also interesting is that beyond the pediatric subset of patients, the vast majority of patients that we identified were younger. So younger patients who, for example, a lung cancer patient who were a non-smoker, who did not have ALK, ROS, EGFR alterations, was identified having this. Another example would be, for example, many of these patients who have papillary thyroid cancers likewise tend to be younger, more aggressive disease. Patients who do not have any of the classical alterations that we see with papillary thyroid, whether it's RET or BRAF, et cetera. These are kind of keys and clues to trying to see and identify these patients that may need further NGS screening with a fusion assay of some sort in order to help identify these patients.